go to special test or stability test?
Just might as well go down the
Capillary refill test.
Okay, but capillary refill test, it doesn't make a difference what position they're in. They could be sitting, standing. A lot of times I like the weight-bearing, non-weight bearing to do this. So what I do is if there's no nail polish, I'm going to squeeze the toe, and I'm going to squeeze it really, really hard, okay, and then I'm going to let go. You'll see the toe should be pink. When you squeeze, it'll turn to a nice pale color, and when you let go, you want to see how long it takes for it to turn pink. That tells you that it's a negative test, and there's usually no problems with the capillary refill. There's no occlusions, there's no problem, the person doesn't have peripheral vascular disease, things along those lines.
Long bone compression test.
Okay, long bone compression test. I'm going to compress things together, as per the name. Okay, so I'm going to have two bones. Let's say I have my phalanx, I'm going to have my first metatarsal. I'm going to take it, I'm going to squeeze it, and then I'm going to relax. What am I looking for? I'm looking for pain, I'm looking for apprehension, the I don't want to do this type of thing, and it normally indicates a stress fracture or a true fracture.
The tap or percussion test.
Okay, tap test is easy. So I'm going to come up here, I'm going to stabilize my toe, let's say it's my first toe, and I think that maybe there's a fracture here, there's a fracture here, and it'll radiate through the bone. So I'm stabilizing, I'm going to tap the foot a couple times to see if I can get a positive test. Positive test means that he's upset, it's painful, and he's apprehensive. And of course it's going to go ahead and tell me that there's probably something going on with the bone, most likely a stress fracture or a fracture.
Special test, Holman sign.
Okay, Holman sign, 3 tests you need to do. So I'm looking at his calf, okay? I don't see any areas of swelling, inflammation, the toes aren't swollen, so that's test 1. If that's negative, I can proceed. The next thing I can do is I can take my hand and passively bring him up, okay? If I passively bring him up and he doesn't have pain, a stretch is fine, but as long as he doesn't have pain, his toes aren't going numb, he doesn't feel like uneasy about it, it's still negative. If it does, it's positive, we stop, okay? My last thing is I'm going to squeeze the calf. Some people will squeeze the calf this way, I don't. I put the balls of my fingers up into it, not my nails, but my actual pads of my fingers up into the actual calf. I'm going to take my hand here, and I'm going to push it up. Okay, I hold that for a few seconds, I ask him how he feels. If he says it's a stretch, it's negative. But if his toes start to go numb, if he feels tingling, things along those lines, I typically think that it is my pathology, which is deep vein thrombitis or thrombophlebitis, okay? Which means that there's something, a clot in the actual leg that's not allowing blood flow to come down.
Festline test.
Okay, my Festline test is an arch test, okay? What I do with my arch test is...
Wait, they put the syrup on it? No, I hate pickles just because it gets all squishy.
There's 2 ways of doing this if you look online, okay? I'm going to find my medial malleolus, okay? I'm going to mark the most prominent place, which is right here. Hopefully you can see that, okay? And it says the base of my first metatarsal. I do here, which is the base, okay? Other people will mark here. Okay, it really doesn't make a difference because it is a flat bone and we're going to line up the same way. I'm then going to take my goniometer because it's the only thing I have right now, okay, and I'm going to line it up. You will see a slight discoloration. I don't want Mike to walk around with purple fingers or purple toes, but you can see that right there. My goal is to find the navicular tube, right? So I'm here. Here's my navicular tube, okay? So it's right on that line, okay? My goal now is to have him stand and recheck. Okay, he has to be weight-bearing on both legs, okay? I will come down, I'm going to find my navicular, and my navicular tube is still on the line. Sit. Since it's on the line or above the line, and then he stands and it's still at the same place, it's negative, so he is not pes planus. If it's below the line and continues to stay below the line, it's something that's called congenital pes planus. If it's on the line or above the line, and then I have him stand and it goes below the line, that's functional pes planus.
Interdigital neuroma test.
Interdigital neuroma test. You want to make sure that the toes don't crinkle. So what I want to do is I normally stabilize just gently right here. I take 2 fingers. My 2 fingers come up on top, right below the metatarsal heads, and I'm going to squeeze. The book says you can hold for 3 to 5 minutes. Normally people will have symptoms, so the toes will get numb, and what's happening is there are nerves between each metatarsal. Okay, and what happens is when they get irritated, they flare up, and what they do is they cause tons and tons of pain, and not only does the pain shoot from this area, it'll shoot to the toes. It'll be very uncomfortable. The patient will complain of pain, discomfort. They don't want to be in this position anymore, and it's positive usually for a neurological issue, a neuroma issue. Okay, if you're between the third and fourth toe, that one we also call Morton's neuroma. Okay, so the one between third and fourth toe is normally Morton's, but any of them can flare up.
Neurovascular assessment.
Okay, so my neurovascular assessment, I am looking for a couple things. One, I'm looking for paresthesia. I'm looking for a loss of motor function, and I'm looking for weakness. Okay, so decreased range of motion, decreased manual muscle testing, and of course any kind of issues of paresthesia. So that's my next section. What's next?
Dermatologist.
Okay, so we're gonna have our dermatomes, okay? It really depends on where it starts. So Mike, I'm gonna have you stand up for me. Theoretically, he should have shorts on. Mike does not have shorts on today. So I'm going to pull his stuff down. Can you kick off your other shoe for me, please? Okay. Good. All right, so now what we're going to do is we're going to look at where his hips are. Can you touch your hips for me? Can you turn sideways so you're talking to her? Good. Okay, so here are his hips. So my first one, this is my uninjured leg. This is my injured leg. So I'm going to go ahead and test. Does this feel like this? Does this feel like this? Does this, L3, feel like this? I usually have him sit because I don't like bending over in front of somebody. The leg's on the table for me. Okay? I'm going to come here. Does this inside of my calf feel like this? L4. Does this feel like this? L5. Does this feel like this? S1. And then of course I'll have him roll over and I'll touch the back of his legs. So does this feel like this? Okay, so that's how I would do my dermatomes.
Oh, that's it.
So my toe
So for all my,
Up here.
so all my toes.
I'm going to have you keep that leg off to the side so that they get a good idea of what's going on. I normally test my non-dominant to my dominant. I'm sorry, I'm going to test my uninjured to my injured. Okay? So I would do that side first and then this side. So what I'm going to do is I'm going to have him not hold on to the table. So he's going to kind of hold himself. Okay? I'll stabilize his back. Bend your hip. Bend your knee. Bring it up. Hold this position. L1. Let's try number 2. Bring it up again. Hold tight for me. Much better. Okay? That's 2. Next one. 3. Bring it up. So that's L3. Okay? Apparently we have some weakness. Okay? I'm going to slide him back just a little bit, like that much. Okay? Next one is patella. Okay? So I'm going to have him take his leg to here. Hold, don't let me move you. I'm going to touch his hip. He knows I'm touching him. And I'm going to say, I want you to resist my motion. Okay? I'm going to be pushing him down. Okay? My next one. Okay? So that I have an idea of where it sits. Okay?
Deep tendon reflex.
Okay, did I get through all those? I didn't get the wrong one, so sit back. So I'm at 4. Okay? You're going to bring your toes up. Okay, hold this. Okay, don't let me move you. Okay, this is the muscle, so I'm resisting here. Okay, my next one, toes out. Out here. Out here. Hold, don't let me move you. Good. Okay. Oh, hang on a second, I think I did it backwards. I did. So L4 is here. L5 is here. It's my big toe. Hold, don't let me move you. My last one is eversion over here. Here you go. Stabilize, resist. Okay. And my last one, is there another one on there? Did I put them all on there? After eversion? It's my hamstring. Turn over. Turn.
Oh, my bad, I was in the wrong
On your
section.
tummy, please. Okay, I'm going to have him here. Okay, what do I want to do? I want to stabilize. So when I stabilize, I'm going to here. Don't let me move you. I'm going to tilt his leg out just a tiny bit. Okay, I'm going to push. Don't let me move you. Okay? So of course, his lower extremity is like a 4 out of 5, okay, because I can break him very easily. Okay? Set for me.
Deep tendons.
BTRs.
Mine's on
you.
the table.
Thank you, thank you, thank you. Okay, there's a lot of them. I don't have them all listed on there, but I'll show you how to do them, so slide down. Okay, my first one is going to be my patella. Okay? Be careful. Here is my patella. Here is my tendon. Here is my tibial tuberosity. I get him nice and relaxed. Okay? If he can't relax, I'm going to have him turn. I'm going to have him sing happy birthday, anything along those lines. It really doesn't make a difference. I'm going to have him here. I'm going to give a little bit of a response. Okay? He doesn't have a great response. Okay? But he does have a response. You don't have to hold if you don't want to, but I knew that he wouldn't give me a good one, so I had to hold him. Okay? Next one, I'm going to have him sit back. Okay? Now, there's a lot of ways of doing this. I'm going to have him go onto his stomach. Holding onto his foot. I'm going to bring him up here. Okay? I'm going to hold down his foot. Okay? And I'm going to bring this to his Achilles tendon. Okay? Not the heel, not a pump bump, not a Haglund's deformity, and not his actual muscle belly right here. So I'm going to have him nice and relaxed. Okay? That's a good response. Okay? This hand is just stabilizing. That's all it's doing. Okay? If you don't want to do it this way, can you roll over again? Can you bend your knee? Okay, you can do the same thing here. Okay? I usually stand to the side because I don't want to be kicked. Same idea. Nice and relaxed. Thank you. Okay? And you're getting the same response. Okay? You can also do hamstring. Flip over. It's the lateral aspect of the hamstring. So what I do is I rest his leg on my shoulder. If I don't know where his hamstrings are, I'm going to have him fire his hamstrings. I'm going to follow to the lateral side. Okay? I'm going to put my thumb on it, and I'm going to have him relax. I'm going to take my reflex hammer and I'm going to hit it. Okay? I'm not looking for the actual leg to jump up. I'm just looking to see if I feel something underneath my tendon, especially since he has pants on. Okay? And I do. Okay? So as soon as I feel that, I know it's positive and he's good to go. Next one is a test, I believe. Yes? It's my Tenel sign. Okay, so a lot of people have plantar fasciitis. Okay, when they have this plantar fasciitis, a lot of times they're not really sure that it's that. They do rehab and all of a sudden it's still not getting better. So you're going to see this nerve come down here, and my job is to theoretically hit it. Okay, I can do it with my finger. Okay, really, really hard as much as I can to see if I can get results. Okay? If I don't get results, I can use my reflex hammer. Don't whack them with the reflex hammer, okay? But follow the nerve all the way down, okay? And when you do, it'll actually irritate the arch. It'll give them pain and discomfort. And that's for tarsal tunnel syndrome. So it's an irritation of a nerve.
I'm in the two pulses. So
Okay, slide back for me. My first one is my posterior tibial pulse. Okay, so I'm going to have him here, okay? Here is actually my tibia, okay, coming up here, and it's posterior, so I'm going to go right below it. Don't crush it, and don't not push in. So I'm going to be here, and I'm going to get it from there. Okay, no problems. If I can't find it, I can actually passively take him out just a little bit, and it pops right in. So right behind it, sometimes it's a little bit lower, but in this area is where you're going to find it. My next one is my dorsal pedal, so you probably want to get on top of him. Normally, we have a first and a second, and where they meet is typically where we're going to find it. And his is right there. Okay, make sure you're not doing it with your thumb, because your thumb has a pulse. Okay, you want to make sure that you're doing it with your first and second. Okay, with him, I knew that he had really good pulses because I checked him last week. So, his is right there.
Thank you, Jenna.